Good morning, Peralta Community College District. Welcome to our town hall webinar on the Safe Peralta Return to Campus. It's my pleasure to welcome you to the webinar today, hosted by Dr. Jannett N. Jackson, the Chancellor of the Peralta Community College District. And I'll turn it over to her in just a few moments. But before we do, I want to let you know that we are in a webinar setting. If you have questions that come up during the presentations today, and there are lots of presentations, please use the Q&A feature to enter in your questions. My colleagues will be monitoring the Q&A and the chat functions. Our goal with this whole webinar today is to get your questions answered. So if you have questions, please submit them through the Q&A form, and we'll try and get those questions answered. The session is scheduled for 90 minutes. We'll be going through the end 11:30. And at the end, when the session is done, we'll be posting this on our YouTube channel and Safe Peralta, so we get the word out. And with that, let me turn it over to Dr. Jackson.
You're muted, Chancellor.
But first, I have to turn myself off mute. So good morning, everyone. I'm glad that you can make it. I know that it was a little bit of a short notice, but I had promised the different groups and individuals that I talked to that as soon as we got our final report on our assessment from Forensic Analytics, who is going to be doing an update today, that I would have a fireside chat or webinar, which is what we're doing right now. So let me just briefly go over the agenda. And again, as Mark said, this is going to be recorded and it will be out on Safe Peralta. So I'm going to just give you kind of a 30,000-foot overview and give you a little bit of a timeline and context of how we got here. And then I will turn it over to IVC Ron McKinley, who will look at it from the perspective of planning on the HR side of the house. And then Vice Chancellor Siri Brown and CTO Antoine Mehouelley will discuss the students and how we are validating and getting proof of vaccination through campus solutions. And then we'll follow that with the facilities update, forensic analytics, and I'll let IVC Smith introduce both them as well as HPLE, the other community partners that work with us on this. We'll touch a little bit on public safety, and then we'll round out our presentation with HERF3 and our spending plans. And again, that'll be done not only by IVC Smith, but also by IVC Adil Ahmed. So with that, I'm going to get started. Next slide, please. So I wanted to give you just, like I said, a little bit of overview of the big picture. I've used the term, some of you have heard me say back to the future, that we need to go back to our touchstone, back to what we know is right, what we know is good within our district, so that we can set kind of a plan for the future. So we started in the spring and summer of 2021 with the closed with exceptions. That was a decision that was made by the board. They extended that during the summer. And then most of our classes were taught online. We had some student services, but they were provided remotely. And then in the fall, the board made a decision, and I'll give you the timeline and I'll give you kind of a calendar of events, that we would launch a soft launch, a phased approach into our return to campus. So we started with the phase 1, and then we also had a phase 2. I sent out some announcements on that. We said we would be open with limits, but we would have more classes that would be taught in person, including about a third of the classes at Laney College, and the other colleges made other decisions, I believe, in letting the college presidents run their colleges, and they working with their individual vice presidents as well as their staff came up with their schedule for the fall of what they would bring back on campus. And we wanted to make sure that we had a safe and gradual return to in-person. And like I said, nobody's done this before, so this is all new. Next slide. So just to put it in context to you, this is the calendar of events. And then I believe there's another slide that actually gives you the details. But the board enacted a vaccination policy on July the 30th. And on July the 30th, we posted on the web a kind of a provisional or draft COVID-19 policy. And I also sent out a notice to the district, to the campus wide. We also sent out all the little blue circles that you see are times that we sent out notices, we published announcements, we had webinars, we met with meetings, and this is just from my perspective. This does not reflect what the colleges did individually or what all of the other vice chancellors did as they went out and met with individuals on campus as well as the district office. And then the fall semester began. And as you can see, just looking at the calendar, that was 24 days. That's a total of 24 days, including the weekends, that we had to remediate all of the concerns that will be identified later on in the presentation at all 4 campuses and the district office. We prioritize those buildings and rooms. And in fact, we covered a little over 30 buildings. Now, we didn't do every room and every building, but based upon the input that we received from the campus itself, we did touch over 30 buildings. We deep cleaned, we changed filters, we erected signage, we established entry and exit points, we conducted and coordinated security. We did meet and confers with our bargaining units, and we established protocols in 24 days. And we did all of that in addition to aggressively addressing the 10 recommendations on the ACC-JC report, which we just submitted last Friday, October the 1st. And in addition to that, we also had to do a report in response to a civil grand jury. So I just want to give a from the heart shout out to all of those individuals that have been involved in getting us to where we are now. We are really forging into new territory and new ground. And we've been the leaders in doing that. If you've been looking at the news and looking at what's been happening nationally as well as statewide. So next slide. So we had to get busy. These are really some of the areas that I've already covered with the calendar and the timeline, but it gives you some of those dates that I talked about. The board made its decision, like I said, on 30th of July. Then we went into the prevention plan. We did an update. We drafted administrative procedures. We sent out an announcement, a joint announcement from me and IVC Smith on the 10th of August. I covered this in my welcome address on Flex Day on the 18th, and then, excuse me, on the 19th. And then we also sent up an announcement a week ago. The last announcement went out, another update. So we have tried to keep people involved. We've tried to keep people apprised. And those are our efforts to be open and transparent. So next slide. With that, I'm going to turn it over because the rest of the staff is going to give you more details. Like I said, I wanted to give you kind of the 30,000 foot view and provide the context of how we get there. And remember, this was all done in 24 days. So with that, I'll turn it over Dr. Ron McKinley, the Interim Vice Chancellor for Human Resources. Dr. McKinley.
Thank you, Dr. Jackson, and good morning, everyone. Next slide, please. So I'm going to try to give you kind of an update, but I want to remind everyone that with regard to returning to campus, this is kind of like building an airplane while we're flying it. No one's ever done this before. Even when the last pandemic occurred in 1918 with the Spanish flu, everyone that's alive today that was alive then, they were children. They had nothing to do with the management of that pandemic. So we don't really have any benefit from that, but hopefully we can write the story and then hand it off to others in case We hope not, but in case there's a need to do something like this again, they might have a better roadmap than we have had. Next slide, please. And of course, the key thing here is our goal is to keep everyone as safe as humanly possible. And I'd like to point that out. That doesn't mean it's going to be 100%. It's not, that's not real. The reality is that we will do everything we can to ensure that we have a safe, healthy workplace for everyone, for all of our faculty, staff, administrators, and also for our students, of course, most of all. And as the chancellor has said, I'm going to recap a couple of dates or a few dates. July 30th, the board published its policy that a requirement that is a condition of employment that all employees and contractors be vaccinated, fully vaccinated for COVID-19, or have a valid declination or an exemption. And exemptions are based on three types: medical, ADA, the American with Disabilities Act, and sincerely held religious beliefs. A little bit later in my presentation, I'll give you some statistics about that so far. There was a policy amendment on August 5th that included students. So students also must be vaccinated, fully vaccinated, or have an approved exemption. And then every person, regardless of vaccination status, must be properly masked. And that means the mask covers both one's mouth and their nose all the time while they're on Peralta property, even when they're outside in the parking lot. Next slide, please. No, so keeping people safe and then communicating facts. And the chancellor has alluded to this, of course, that the classes began on a limited basis on the 23rd of August. There were many presentations to the board, also many other announcements. And as the chancellor had said, we have met with all three bargaining units. In fact, we meet again with the PFT tomorrow to discuss working conditions. And we have another meeting coming up with SEIU to do the same thing. So we've announced the policies. We have lots of FAQs on Safe Peralta. We've drafted a protocol or procedure of how we're going to manage COVID-19 vaccinations and exemptions. We have the COVID prevention plan, which is required by Cal OSHA. And if you read that, it's about 25 pages long, has lots of words, but has lots of good information. And it's mostly Cal OSHA language. We're doing screening and proof of vaccination requirements. Students are screening using Campus Shield, and employees are using Company Nurse. We continue to evolve our response to COVID-19 following our soft launch, and we're doing such things as pop-up vaccination clinics on various campuses. Laney College has a vaccination redistribution site. That simply means that it's not open to the public, but only to our students right now, and then possibly our staff later on. We're doing testing, or will be doing testing 5 days per week. And VC Smith will talk more about that later in her presentation. And we continue to have everything posted. We're also validating COVID-19 vaccination documents using the California COVID-19 website. 2-week return notices may be sent as early as today, requiring some employees to return to campus or return to work. And the timing of that and the exact schedule of those will vary per college, as that's been delegated to the presidents by Chancellor Jackson, because one size doesn't fit all. Next slide, please. And then keeping keeping people safe, and then holding ourselves accountable. As I've said before, our goal is to keep everyone as safe as humanly possible. We don't want to discipline anyone. That's not our goal. Our goal is to keep people safe. However, there are consequences for failure to comply. This is a condition of employment, just like getting your TB test. So disciplinary action, if indicated, will be applied per the requirements of the various collective bargaining agreements with the three bargaining units beginning the week of October 8th. Requirements will be enforced with students beginning the week of October 13th. Penalty for falsification of vaccination status or forged documents is very serious. It then subjects students to disciplinary action according to BP 5500 and AP 5500. And with regard to Article 4, Section 8, that deals with dishonesty. The same thing applies to employees in the Education Code, Section 87-732, which also includes dishonesty, among other things. There's a long list there of things that employees can be disciplined for. Using a false or forged CDC COVID vaccination card is a felony. It's a federal felony that's punishable up to 5 years in prison and $110,000 fine. Should be noted that we know that these things are available online. You can purchase them. So when we discover this, we will take very swift and decisive action and apply logical consequences. Next slide, please. Then keeping ourselves safe again, want some additional facts. Things are evolving quickly. We all know this, that this last 18, 19 months, everything has been changing very quickly. Therefore, it's imperative that we as an institution and the community remain nimble and that we respond accordingly. And that means that things are going to change. So we may say one thing today and something else tomorrow, because that's how quickly things can change. We would ask you to please keep up to date with what's going on. Please refer to Safe Peralta website frequently, and you're going to see lots of information there that will be changing very often. Some quick facts. As of October 1st, we had a total of 861 full-time employees, 660 of which is about 77%, have provided vaccination documents via company nurse. There have been 19 requests for exemptions for those 3 reasons we talked about. 11 of those have been approved, 7 have been denied, and there is 1 that's pending. The one that's pending is with our attorneys, and we're discussing how that one might end up. And that's the end of my presentation. So I would like to please then turn it over to our CTO, Antoine Mehouelley, and also our Vice Chancellor for Academic Affairs, Dr. Siri Brown.
Vice Chancellor McKinley, there are several questions in the Q&A related to what you spoke to. Is it okay to share them now, or did you want to deal with them later?
I can share them now. I'll also type an answer in. So,
Okay.
All right,
Okay.
so
I'll go ahead and read them.
okay.
Will there be more on-campus vaccination opportunities, and will employees be able to get the booster vaccines?
So the answer to the first one is yes. Our plan is to expand the vaccination clinic on Laney, and we will be doing other additional pop-up clinics from time to time. And of course, if the vaccination boosters are approved for everyone who right now you have to be 65 or have one of those underlying conditions in order to get one, but as they are, yes, they'll be provided. Next question, please.
Okay. By which date are individuals required to resign who have moved out of state if no telecommunication or hybrid working option is available?
That's a good question. I don't know the answer to that right now. I will get back and we'll post an answer on the website in the Q&A.
Okay. And how did Board of Trustees vaccination policy then result in 24 days to remediate 4 campuses?
Well, the policy was published on July 30th, and that means we had 24 days to do what was necessary to implement the policy, because the policy went into effect immediately. In other words, and then we had time to actually bring things about to begin to enforce the policy, which is the reason for October 7th being the enforcement date of the requirement for employees and contractors to be vaccinated, and then October 13th for students.
Okay. And there's a follow-up to that question. It says the fall schedules had been published for months, including Laney planning for 30% of the classes being face-to-face. Does this mean that the district has been planning to not allow Laney to do the 30% of classes in person, even though the schedule has been published?
No.
Okay. And then another employee is indicating that What do staff do when if they do not feel safe?
If they don't feel safe, then they should talk with their immediate supervisor and discuss the reasons for their not feeling safe.
Okay, and can we implement social distancing as well? Kaiser is implementing social distancing. There are many examples of vaccinated people getting COVID from other vaccinated people.
Well, in fact, we do have social distancing. If you go to one of our campuses, to one of the check sites, that you will see there's signage up there asking folks to social distance as appropriate.
Okay. And there's also questions about folks submitting their vaccination status, but the company nurse platform still showing unvaccinated, and how do they get that resolved?
Yeah, we've received that notices from several employees about that, and that's being fixed today. So that should not. Now, company nurse, like any other IT application, CTO, Mehouelley, but do have glitches in them from time to time. So please be patient, and we will work. As soon as we get reports, we will get those things fixed.
Okay. And why was the weekly testing option eliminated and only for those with approved exemptions?
There was never a weekly testing option. A condition of employment means that a person must be fully vaccinated or have an exemption. The testing is for those folks that have an exemption. That's a requirement, not an option. And I'd like to point out that I'd already said that we're not going to be able to make this, that we can't do everything. We will do everything humanly possible. That doesn't mean that things will be perfect. What I can say, though, is that the steps that we're taking they're going to ensure that Peralta campuses are among the most safe places to be in the pandemic ever, because we will require masking, we'll require vaccination, we require testing of those folks with declinations. We're doing all of those things to keep people safe, and it's going to be safer than your restaurant or your doctor's office or the theater or any of those other places that a person might frequent, the grocery store, the convenience store, or the gas station. It doesn't make any difference. Are there any other questions?
Yes. Will PCCD offer additional COVID sick leave if someone contracts COVID due to an on-campus exposure?
Currently, the additional sick leave that was mandated by the state expired on September 30th. There are no current plans to reinstitute that unless it's required by the state of California.
Okay. And will the requirement for being vaccinated require that individuals take all future boosters?
Yes, if they're eligible.
Okay. These questions keep coming, you guys. I know we got to keep consideration of timing, and you guys let me know how you want to handle that. I can continue to read.
I can answer the others on the. I'll type them in.
Okay, sounds good.
Thank you, Dr. McKinley. For IT, we were tasked to come up with a system to have a verification for the students' vaccination and testing. So we have done so by creating the capability to be able to upload for students to be uploading the vaccination status weekly, the vaccination status or the testing weekly to the Campus Solution, the student-facing portal, and within PeopleSoft. So that data will be available to the presidents, the vice president, and the deans district-wide. And also we have made the data available, some studies available for faculty to know what the status of their students. And I'm gonna hand it out to VC Brown. The system, just to let you know, the system will be released sometimes today, and we'll be doing some testing and creating the documentation that will be shared with everybody. So I'm gonna hand it out to VC Brown to discuss more on the policy of the decision-making, who needs to see the information on that. VC Brown.
Thank you, CTIO Mehouelley, and greetings, everyone. So the instructions for students on how to upload proof of vaccination or request for exemption are forthcoming and will be shared widely with students. When it comes to the due date for compliance, we did discuss and extend the deadline for students to October 13th. And you may have seen that communication. So what we are requiring is that students who are taking currently this fall, taking face-to-face classes and or seeking face-to-face student support services will be required to comply with the vaccination policy. This fall, fully online students and students who are not going to go on campus will not be required to comply with the policy. However, come spring semester, all students, whether face-to-face, fully online, hybrid, even those who think they aren't going to come to campus, will all need to comply with the student vaccination policy. And again, they have options to apply for the exemptions that were described earlier. And we did this in a conversation and deliberation about how to best try to accommodate the fact that students are challenged with many things, including getting compliance to these requirements. So in discussion and deliberation around the student protocols, our priorities were and remain health, everyone's health, staff, faculty, students, classified professionals, managers, the campus health, privacy, student privacy, and equity. So health, of course, is something that concerns all of us, and that's why we're asking so many questions. But privacy is very, very important because students are protected under HIPAA laws. And those laws require us to maintain privacy. And certainly, as you know, privacy around medical status or medical specifics. So the rosters that faculty will see will say cleared or uncleared. This then protects HIPAA, but also lets the faculty feel assured about the status of their classroom. Equity is an issue for us because some had brought up that security should be used if a student, is trying to come on campus or is trying to be in class, or the police should be called. But we don't want to set up a situation where inequity occurs, nor a policing around vaccination. As many of you know, African Americans, Latinx, Indigenous, and other communities of color have a higher rate of not wanting to be vaccinated and have historical reasoning for that. So we didn't want to have any kind of unconscious bias involved in this process with students, which is why what we have decided to do is to contract with health professionals who will be the ones who see the lists of students who are cleared or not cleared, be at the entry points on campuses, so that if a student comes and let's say they've been granted exemption, but they were not able to get their COVID test this week, that it would be a health professional that would talk to them as opposed to someone else, a manager or security. And the health professional then can guide them to resources. IVC Smith is lining up rapid testing for each campus, and rapid testing will happen at 1 day a week at each campus at this point. And so what we are doing is aligning the exempted students' due date with the same date that rapid testing would be available. Although the hours for rapid testing might be limited, it at least provides an opportunity for a student who missed a test to rapidly get tested and be able to enter the classroom if the test is negative. And so those are the priorities, is the HIPAA bound, the privacy, and the equity. So what will happen is that compliance will be checked at the entry points, as I said, and we are already sending out, Mark Johnson's office is already sending out communications to students by email and text, and will continue to do so, as well as on Canvas banner, to ensure that all students know what's happening, when they have to be compliant, how to be compliant, and then very soon the instructions on how to upload the documents that are required. Thank you. All right, we can go to the next. IVC Etheria Smith, thank you.
Good morning, VC Brown, and thank you for the introduction. I also just want to reiterate in your last points, you were saying that testing will be available. We are in the last getting our sign-offs for testing. There will be testing once a week at each campus, and also at the district office once per week also. So next slide, please. There's a few folks that have really stepped in and helped us. We have forensic analytic, we have HPLE, and we also have Knowledge Saves Lives. I'd like to first introduce forensic analytic to go ahead and please present their HVAC report and give us an update of their assessment and the items as they've tested for the last 23 days. Malik?
Yes, thank you, IBC Smith. Can you hear me all well?
Yes.
Yes.
Okay, thank you. So my name is Malik Alawi. I'm a industrial hygienist with Forensic Analytical. I have on the call with me Madeline Rebelita, my colleague. Both Madeline and I work with a lot of cities in the Bay Area, colleges and school districts to develop safe work practices and assess their facility readiness for reoccupancy. So before I discuss the scope of work, let me introduce first the concept of industrial hygiene. And I know that probably a lot on this call don't know what industrial hygienists actually do. So we are scientists who try to proactively manage risks associated with built environments. It can be occupational and non-occupational settings. We identify those stressors and hazards and evaluate the intensity and the impact on occupants' health. And as a result, we will propose mitigation steps, and there's a hierarchy of control that I will discuss in a bit. So hazards can be physical, chemical, biological, and ergonomic in nature. And our hazard of concern is of biological nature, which is the SARS-CoV-2 virus or coronavirus. We know that the virus is transmitted from person to person. It has some airborne characteristics. And although it's less likely to occur, we cannot completely eliminate the surface transmission. In terms of impact, the person-to-person transmission remains the primary route of transmission of the virus. Now, the hierarchy of control is multiple steps. Of course, elimination and substitution are the most effective, but when we talk about a pandemic, it's actually a combination of all these steps together. So elimination is like the eradication of the virus, and that requires medical intervention and to achieve a large scale of immunity. So what the district is doing is actually trying to achieve engineering and administrative control as their role in combating the pandemic. And as industrial hygienists, we focus on this step, which is the engineering control. Now, accordingly, we propose a two-phase scope of work. We focus on the HVAC system, which is the nose or the respiratory system of the building. Part of the industry guidance and recommendation during the pandemic was to assess and the operation integrity of those systems, and knowing that these systems at a minimum should operate at the design performance. Before we talked about upgrading those systems and upgrading the filters. So these systems should be efficient by design. So the first step of phase one was a qualitative environmental assessment of these HVAC units. So we visually assessed the components of those systems and the structural integrity. The second step of phase one was an initial ventilation assessment where we actively measured the airflow in identified buildings. Phase two of the scope of work would be re-evaluating those HVAC systems after all the mitigation steps have been implemented by the district. The assessed sites were the 4 campuses and the district offices, and we assessed over 170 units. This is just to present the concept, a simple concept of what an HVAC unit looks like. This is a simple, package unit design using PowerPoint graphics, just to let you know how the whole thing works and how the different components of the HVAC system act in harmony to promote indoor air quality. So the unit has a blower or fan that when running will create a negative pressure. This would draw in outside air through a bird screen, which is the first line of defense of the unit itself. And by its name, it intercepts larger particles like feathers, insects, and large debris. This will go through dampers. These will control the percentage of outdoor air drawn into the unit. It will be mixed right here. So you have new fresh air with return air coming from indoor spaces, and they will be intercepted by filters. Now, these filters, depending on the efficiency, will intercept the particles and will treat outdoor air. This is where, so if these HVAC units are equipped with conditioning features, they will be conditioned through the coils, where heat exchange will occur, and as a result, we will have condensation. The condensation will be collected on a condensate pan and will be drained outside the unit so that it prevents overflow inside the unit. And then after the conditioned air will be supplied to the indoor space, it will be mixed with the existing indoor air, people breathing, anything that is emitted by the building itself from building material or from processes or human activity. And then it will be drawn back through the return duct and into the mixing chamber. And the cycle goes on and on. So every part of the HVAC unit is integral in promoting a healthy indoor environment. Now, this is a bit a complicated, relationship chart, but I just want to share two examples of how any suboptimal condition can lead to indoor air contamination. Let's take, for example, obstruction to outdoor air intake. If we obstruct outdoor air, we are relying on higher return air volume. In the absence of efficient filtration, this will lead to improper dilution. And dilution is the act of introducing fresh and clean air to push out dirty air and reduce the concentration of contaminants indoors. Another example would be corrosion. So when we inspected those units, we looked at the integrity of the housing itself and then the individual components inside the HVAC system. So an invasive corrosion where you have holes in the housing would allow for pests, for example, and rodents to enter these systems, and they will chew on the components, insulation, and electronics. Another result would be rain penetration or water penetration. And as a result, when water is combined with broken or deteriorated insulation, this will create a favorable medium for fungal growth. So as you can see, the HVAC unit's function is to promote indoor air. However, if it's poorly maintained, it can be a source of contamination to building occupants. Excuse me. For this reason, we created an HVAC assessment tool. Now, this is now in the district's inventory, and this tool was created so that the district's personnel and maintenance can use it for ongoing and preventive maintenance. So what we have a two-pager report whereby we cite observation related to those individual HVAC components that I covered in my previous slide. Then we will document with photographs, and the second page would be general preventive recommendations and specific, recommendations for remediating the suboptimal condition. I can share the actual tool depending on the time by the end of this presentation. I'm going to share some of the images that during our walkthrough assessment. So beginning with filters. This is an example of a collapsed filter due to dust overloading and debris combined with some moisture will actually collapse the filter. We've seen filters that fallen off the filter rack inside the mixing chamber. So it's allowing untreated air to penetrate the coils and the indoor spaces. This is an example of a trimmed filter, which indicates incorrect sizing of the filter. So if the filter doesn't really fit inside the unit, we should customize the filter and not trim the edges of the filter, which will create gaps. This is an example of a gap created between two adjacent filters due to structural damage of the filter itself. This is an example of this one and this one over here are examples of mold infested filters. And and the flow chart that I shared previously shows what are the conditions that promote mold growth for different HVAC components. We've also looked at the last date those filters were changed. And as you can see, we have filters that haven't been changed since 2014, 2018, and 2017, which was way before the pandemic started. We look at outdoor air intake as well. So we want to look if the dampers are actually working so that they can introduce outdoor air. We looked at any kind of obstruction like shrubs or plants or vegetation crawling into the intake. This will allow a pathway to, again, to pests and rodents to enter the unit itself. We looked at sources of contamination. And this is an example of a roof penetration or exhaust within a certain distance of the outdoor air intake, which will introduce some toxic emissions possibly to the indoor spaces. And mind you that the filters are filters that will intercept particulates and not gases and toxic emissions. This is an example of, this is the most disturbing picture. This is actual fecal matter, fecal pellets, right under the outdoor air intake on one of the buildings. We don't know what the origin of. We would like to think this is of animal origin, but this is one of the cited observations as well. Insulation is very important, and the integrity of the installation is very important as well. This is like an early warning. We call this delamination. So this is an early warning that insulation will deteriorate completely, and it will, and this could be an end result of what a completely deteriorated insulation is. This is not only will create a medium for fungal growth when combined with moisture, but it can also obstruct or clog the condensate port, whereby the excess water will be drained outside the unit. We also looked at, so these HVAC units are not only on the roofs of the building, but also inside mechanical equipment room. So we look at the general housekeeping condition or cleanliness of these rooms. And as you can see, some of these rooms have been repurposed to be storage rooms. We cannot allow paint inside or next to HVAC units. Some of the volatile compounds emitted from paint will accelerate corrosion of metal, which is one of the major components of your HVAC system. We're also seeing clean and new filters exposed and stored inside these mechanical equipment room. Well, at least they should not be in direct contact with the floor, especially when you have something like this, which is water leaking from pumps. As you can see, it creates some calcification and the water is stagnant, and it can actually impact the boxes, which is cardboard material. And as you can see, the tip, the lower left corner of this box is wet. So we want to make sure that these filters, this is another example of storage, are properly isolated and elevated from the ground level. Cooling coils are a major integral part of the HVAC system, whereby a damage to those coils may require the replacement, the complete replacement of the unit itself. Now, the damage can be for physical damage or due to corrosion, as you can see. This is an example of a clogged condensate port. So this is due to dust buildup and debris. So that may result in water overflow, stagnation, and eventually microbial growth inside the HVAC unit itself. Corrosion was one of the major, cited observations we had in most of these units, most of the older units. So you can see there, sometimes we have superficial corrosion that may be treated immediately or in-house, but But those movable parts inside the units, like the filter racks, for instance, when they're heavily corroded, they lose their structural integrity, and the filters are not fit in place anymore. So that would result in gaps and then, in filter bypass into the indoor spaces. Fan belts are also very important. They are overlooked in some of the units. The tension of those belts are very important so that we have efficient rotation of the fan and we're not wasting energy. Some units had either completely absent belts, broken belts, or as you can see, very loose belts. The next step was to come up with a summary of our findings, right? So we categorize all these observations based on what can be immediately remediated by the district without, extensive professional intervention, what may require professional intervention, and what definitely requires professional intervention. So we have the number of units based on decided observation, the number of buildings, and the number of campuses. And there's a detailed summary provided to the district with all these units, the unit numbers, the building name, and the campus location. Now, what is immediately treatable was actually remediated by the district, which is the filter change. So the district replaced all filters, and all these filters are MERV 13 rated. Now, mind you that upgrading the filter to a higher efficiency will provide cleaner air, but higher efficiency means higher resistance. So as a second phase, we wanted to assess whether these high efficiency filters impacted airflow. So we don't want to treat a solution by a problem by creating another one. We have provided this is just statistics on where we found where were the majority of these observations located. And mind you that this is proportional to the number of buildings for every campus. You'll obviously see that Laney always shares the higher percentage, followed by Merritt and College of Alameda. However, what was notable is that some of these observations were absent in some of the buildings. For instance, we didn't find damaged coils in College of Alameda. We didn't find missing bird screen in Berkeley City College. The same for tears in the duct. So this summary again is now with the district's inventory, and they are using it to plan the next mitigation steps. Now, the second step of our phase one was the ventilation assessment. We looked at some industry benchmarks to see where we stand in terms of adequate ventilation. This is what we wanted to assess. We wanted to compare what we currently have in all these spaces to what the industry is recommending. So we selected a number of rooms in identified buildings, a total of 106 rooms. This is not every single space in the district. We chose those rooms to represent different HVAC units. We selected those units where we got confirmation that the filters have been replaced and changed to MERV 13. And for this assessment, we created a different assessment tool. We used what ASHRAE put together, and ASHRAE is the American Society, formerly known as the American Society of Heating, Refrigeration, and Air Conditioning Engineers. They set industry standards for the design of the mechanical infrastructure of buildings. So for ventilation, they have recommendations for minimum outdoor air for the breathing zone of building occupants based on the number of occupants and based on the square footage of that space. So we use that calculation. And for the pandemic specifically, they put together a tool that will calculate what we call the effective air change. I will also share this tool and run a quick simulation by the end of this presentation. So what is effective air change? Well, it's actually the number of air changes. How many times clean air is being introduced in a certain volume, in a certain space, and is effective in removing droplet nuclei, specifically spit particles, because we're concerned, with the COVID-19 disease, and we want to make sure how can we effectively reduce or control the level of spit particles or droplet particles inside a given space. So in order to come up with this value, we have to assess the MERV rating of installed filters, the total supplied air in the room, and we measure this with the cubic feet per minute unit, and the percentage of outdoor air introduced through the HVAC system. Now, in the event where we don't have the value or information for outdoor air, we estimate a minimum so that we are representing the worst case scenario inside those spaces. Now, we need to compare this value to a target or a benchmark. At a minimum, we should meet the design. So this HVAC unit and this space must have ventilation or a percentage of clean air to meet the design. So the number of occupants, and this is not necessarily the occupancy load of a building. We determine the maximum number of occupants for given rooms for probably fire evacuation, fire code, or building code. We do not design HVAC systems based on fire code. This is designed based if the engineer is given this information ahead of time. We know what the maximum number of occupants inside those spaces are, and then we estimate the ventilation. In our situation, for classrooms, for instance, we counted the number of chairs and with the instructor and estimated that this is the occupancy, unless it is posted somewhere. For conference rooms, for instance, we counted the number of chairs around the table, and for open space, large space cubicles, we counted the number of cubicles in the cubicle farm. So we wanted to make sure that we are at least meeting the minimum. Now, if this minimum is lower than 3 air changes, we defaulted the minimum to 3 air changes. And the reason for that is in the technical resources provided by ASHRAE, they recommended a minimum of 3 air changes because 3 air changes are efficient to reduce 95% of airborne contaminants. However, if by calculation, the minimum requirement exceeds 3 air changes, then we take that as our minimum number, and we see where we stand in terms of number of air changes. So again, to calculate the target air changes, according to ASHRAE standard 62.1, we calculate the square footage of the space, occupancy, and we look at the space category, the functional space itself. A classroom differs from an office space, differs from a conference room. Each would require a certain amount of outdoor air based on the category of that space. So we had 20% of our locations were classrooms, 8.5% science labs. And as you can see, we chose instructional and non-instructional spaces. We're concerned with the health of both students and staff members. And this is the pass rate of after we conducted the ventilation assessment of all these spaces. As you can see, these are considered as high pass rates, right? For instance, locker rooms, we only assessed 3 locker rooms, of which 2 passed and 1 failed. So this is why the percentage is impacted. However, all science labs, for instance, actually had either they met the minimum requirement or substantially exceeded the requirement. And this is very important, knowing that a lot of processes, chemicals, are being used in those spaces in the presence of students. The percentage of the 106 rooms that actually passed are 83% compared to 17%. And this is the distribution of the spaces across the campus. Again, Laney had the largest share because of the largest number of buildings it had, followed by College of Alameda, Merritt, the district, and Berkeley City College. Phase 2 of this assessment, after all the remediation steps are implemented, we may expand the ventilation assessment sample. So we have larger space, a larger number of spaces where we want to actively measure airflow. And we will reevaluate all the HVAC units after we complete all the after all the recommendations are implemented by the district. Now, let me share an example of the assessment tool now that I have time.
Excuse me, Malik, if you
Sure.
can do one example, because we're going to have to keep moving.
It's only one example, and can you see my Excel workbook?
Yes.
Yes.
Okay, so this is an example of a classroom whereby the minimum requirement according to the ASHRAE 62.1 standard is 5 air changes for this, given the number of students, 34 students, and again, we counted the number of desks and the square footage and the ceiling height, the volume of that room. Now, we measured 3.4 air changes, and there's obviously a gap between 3.4 and 5. Therefore, this Excel workbook calculates how much supplemental clean air we need to offset this gap, and it gives you the clean air delivery rate required by a portable air purifier, for example, a portable air cleaner to offset this gap. Now we have another option. These 5 air changes are calculated based on 34 students. So if we reduce this number to half, for instance, now we are exceeding the target. So this will help us actually implement a variety of efforts so that we are achieving a certain number of air changes. It's a complicated tool, but this is really an integral, it's with the district's inventory, and this can be used by facilities and by the district personnel for, again, for ongoing maintenance and evaluation. Thank you, IBC Smith. If you have any questions.
There are lots of questions in the chat, so and in the Q&A. So let me know when you guys are ready to hear those.
Sure. Why don't you go ahead and start with the questions?
Okay. Several folks have asked about whether the report will be shared with everyone after today.
Yes.
Okay. And then there was the last handbook regarding return to work had a lot of information, but very little guidance on how to implement the items in it. And there was no designation of who was responsible or who to contact to take action. Has this been updated?
I'm trying to understand that question, so I'll respond as best I can. With facilities, it's under DGS. Right now, we made every effort to make sure that we put clean air filters in the buildings that were identified. We will come back again and do it district-wide. There's clean air within all the buildings that they are operating in. However, right now, we are at the next level where we are now trying to understand and manage the efficiencies of the units that we have now. And that will give us time to look at those units, evaluate them. If we need to do different air filters, understand how often we need to change those air filters. And also in that red zone that Malik referred to, if we have to change the units itself. So that's our next step. That's part of phase 2. And we will go through that a little more. I hope that answers that question.
And I would just add a little bit, because I think it was more general than just with DGS. If you as an individual, we have in the military, call it a chain of command, and we have the same thing here. If you have a problem and you have a concern, the first thing you should talk to would be whoever your supervisor is. If you are a faculty member, that might be your dean, or it may be your department chair, your vice president of instruction, president, and then from the president to me. And then I have the staff here at the district office. If you're a classified professional, it would be your supervisor. Your supervisor hopefully has a supervisor until it gets up to the president. And again, it would then come to the district office and to me. We also have work orders. So if there's something that's broken or fixed, or you notice is making a clanging noise, then utilize that. If we don't get back to you in a sufficient amount of time, or what you think is sufficient, again, bring it up the chain of command. So we can't address everything in a manual. There's so many different variables out there. And that's why we have these, communications that go out through various different methods to try to catch everyone in one way or the other, whether you're a person that likes to blog, if you like to get emails, if you like announcements, however, or if you like this, webinar, face-to-face. So we're trying to do the best we can, given that this is always changing and always evolving, and there is no way that you can write a document that is going to cover every particular instance that's out there. So the other thing I wanted to say is we are getting a lot of questions, and I do want us to get through the rest of the presentation. So if we can, we will, because there are some questions that are philosophical that are out there. But if we can, we will answer all questions. They will be posted for review, and we will set up a FAQ for those types of questions because some of them are repetitive, just a little bit of difference from one thing to the other. So just so you know, if your question didn't get answered, it isn't that we've forgotten about it. It may take more than just a few sound bites to discuss that. So we will try to address it at a later time. And I think I'll take over. I'll pass it on to Michael Terry with HPLE.
Thank you, Chancellor. Again, Michael Terry. On behalf of HPLE, I want to express our sincerest gratitude of being selected as the project manager and community partner to coordinate the district's Return to Campus initiative. We are proud of our role and offer the following overview of our assistance to the district during the Return to Campus initiative. Next slide, please. The following responsibilities included, but was not limited to, the Return to Campus activities, managing a deep cleaning coordination schedule, and assisting to develop the campus security plans. Next slide, please. Again, here I won't read it all out, but each campus had a select number of buildings that was available for the start of the fall semester. And our initial focus was supporting the campus strike team and preparing the buildings for full operations. We had a number of meetings, almost more than 50, with a large cross section of the district, community administration, faculty, staff, and various consultants, all tasked to ensure that the campus was ready for the start of the fall semester. Next slide, please. The Return to Campus activities consisted of the following 6 components shown here, and DGS administration, engineering, security, IT, campus representative, and custodial services. Next slide, please. But just to be clear, we assisted DGS with all of the following list of activities, with a large emphasis on managing the cleaning contractor, which included sanitization of high touch surfaces, really important as going forward, coordinating access for air, water, and surface testing by the testing companies. And of critical importance was coordinating with the college campuses as the RTC activities were progressing. Next slide, please. HPLE confirmed the replacement of air and water filters was as appropriate, and that HVAC startups and air balancing was performed, and that the air flushing, and the flushing of plumbing water fixtures were performed. Next slide, please. HPLE worked with the Knowledge Saves Lives and Marina Security to develop campus and building access points, but more on that later. As you can see here, managing, monitoring, and patrolling all entrances, ensuring staff entry verification checkpoints. Next slide, please. And a very special thanks to the district's IT department for the following, for providing the IT support shown here for building access points and the checkpoints. A little bit more on that later. Next slide, please. Each campus provided a contact person who was committed to solving the challenges and ensuring that the campus was ready for the fall semester. Critical in that effort was each campus's screening support for campus and building access. Next slide, please. The district's custodial staff was invaluable in ensuring campus occupants would have restrooms properly stocked, sanitizers provided, and trash bins clearly marked and accessible. Next slide, please. But it's really important to state that this effort took all of us. I mean, it was a massive effort in a very short time frame, and without everyone's involvement and the really commitment of everyone involved on the panel, at the colleges, and everyone that I came across, and I was at each of the colleges, we would not have made this start of the fall semester. Next slide, please. As seen here, there's an overview of the, in terms of the square footage, just to give you an idea what the volume of square footage that was involved, and the human resources and planning and scheduling that it would take to accommodate the cleaning, the selected buildings by the start of the semester. Next slide, please. Each campus had the buildings prioritized and scheduled for each building. And as you can see, the schedule was actually created in to accommodate each building. Laney obviously being the biggest campus and some of the larger buildings, we had to go in and really do a good job of figuring out how to access and allocate that resources. Next slide, please. And no campus is too small. We have a very wonderful but large building at Berkeley, and each college was given a schedule of when the cleaning crews would be at the campuses, and HPLE made personal contacts with each site to coordinate any challenges that may come up. Next slide, please. Again, each college has their priority of buildings, and you'll note that in many of the campuses, there is a consistency of having the childcare centers first and foremost as a priority, to be certain, of course, our children must be protected, must be safe. And of course, allocating this time and scheduling for each of the buildings. Next slide, please. And no, last but not least, Merrick College and its building priorities and schedule. Next slide, please. The colleges were the priority. However, the district administration facilities also received the same cleaning and attention. Next slide, please. I'll take a moment here. HPLE collaborated with the district's IT, Knowledge Saves Lives, and Marina Security to identify and develop the campus access plan, building access points, and screening checkpoints for each campus. HPLE developed and managed all signage and its installation. And you'll notice in the legend here that the black indicates those facility buildings that were not in operation for the fall semester. You'll also notice the yellow arrows, which indicate the campus access points. You'll also see the green dots, which is the assigned security for the building access. And then you'll notice the star, which is the checkpoints. And I'll just take a moment to say that each of the campus access points, you're greeted by instructions for accessing the campus and safety guidelines and access for safety guidelines. You can use the QR codes from a mobile device app to download a daily pass, or you can display a pre-printed daily pass. And if it helps, you can also go to a screening checkpoint to have a daily pass given to you and to get any further assistance on how to access the campus. Next slide, please. This was done for each of the college campuses. Here you'll see, Laney, the various access campus access points, the various assigned building checkpoints, and then the R's. This is important because obviously Laney is a very porous campus, so you had to have a roving security to make certain that individuals were reminded that you needed a daily access points in order to, daily access pass in order to access any of the buildings. Next slide, please. Similarly, at Merrick College, very high, another porous campus, same idea, the various campus access points, followed by the building access points, and then the roving security to remind individuals of that they will need a daily access pass in order to access the buildings. And that's the end of my presentation. Any questions? Okay, I'll turn it back over to.
Thank you, Michael. This is Etheria, IVC Smith speaking again. I'd like to talk a little bit about public safety, excuse me. We are in our final stage of recruiting for the Director of Public Safety. Hopefully, we're checking the references now, and I'm looking forward to that person coming on. But in the meantime, I'd really like to thank Knowledge Saves Lives. Thank you, Paul. If you would go and please give us a little update on what Knowledge Saves Lives and public safety has done over this time.
Sure, absolutely. So good morning, everybody. My name is Paul Yanez. I'm currently the consultant assigned as your interim director of public safety. I represent an organization, Knowledge Saves Lives. We help school districts up and down the state of California. So with the return to campus program that we launched, we brought in 29 additional security staff from Marina Security Services. That's who's providing your security now for the campuses. The security team that was brought in, 29 additional employees. We're all trained on Campus Shield, familiarization, customer service on how to help people, log into the app and things like that. They received additional campus security training, as well as working with HPLE and the district to strategically place them in positions to monitor the access points so that people had a way to check in and show their app. The second thing that we've been working on for the past few weeks now, going on 7 weeks, is I've been working directly with the city of Oakland on a memorandum of understanding, an MOU, to bring in a few things. And so one would be the MOU for the city of Oakland for law enforcement investigative resources, as well as emergency response resources to Merritt and to Laney College. I'm also working on a parking policy. I know that's been a frustrating topic for people. Some of the vehicles that are parked in front of the colleges, people living in their cars for extended period of time, not being able to access the sidewalks. All of that is a huge concern to me. So we have a draft policy written now. It's going to go through the shared governance process at some point. But I've been working directly with the city of Oakland to get us those resources so they can come out and address these issues sooner rather than later. We're also working with the city of Oakland on updating all the available resources. I know that our district has a ton of resources that we provide to students and staff, but there are a ton of resources in our community. And with PCCD being part of this community, we wanted everyone to be able to work together and share those resources. And then lastly, I've been working with dispatch. So Marina Security Services has dispatch. The number is on your screen. If any incident is reported to dispatch, we now have the ability to cross-reference and record management these types of calls. So what that means, if somebody calls and has a security concern, reports vandalism, a theft, anything like that, we can now search that call and compare it to things. So we can compare it to possibly if it happened on camera, if we caught it on video surveillance, or if you reported something to local law enforcement, we could cross-report it to the district. And so again, we want people to know about that resource. And if anything comes to concern, anything at all, please notify our dispatch, and we're happy to help. And that concludes my report. I'm happy to answer any questions anyone has.
Thank you. Thank you, Paul. Again, I'd like to thank our partners, HPLE, Forensic Analytic. I'd like to give a special thanks to Carrie Burdick in risk management. I'd like to thank Kathy Neal as process procedures and helping with special projects, and our staff who again, we've all jumped in and tried to work as quickly as possible. Let's go on to the HERF spending plan. I'd like to turn
I'm sorry, VC Smith, there are a couple of questions related to the last presentation.
Okay.
This one says, displacing homeless people during a pandemic. Are we also coordinating with organizations that advocate for and support the homeless, or only with the police?
So actually, we're coordinating with every resource we can get a hold of. And that's the top priority. It's not just law enforcement, but there are several issues that have come up with parking specifically that we're trying to address. So if we had more than one resource for it, I'd be all over it. But right now, the city is the only resource I have for parking. But yes, as far as advocating for the homeless, yes, we're reaching out to every available resource.
Okay, and another one. At least one Marina employee has told people on our campus that she is not vaccinated and has no plans of getting vaccinated. How are you going to enforce vaccination policy for Marina employees?
Marina Security Services will be held the same accountability as students or staff. So no one's going to be treated any different. They'll be following the same policy.
Okay, and let's see here. They're asking about social distancing inside the classrooms. There have been several questions about that, and how are we requiring that? How are we enforcing that? There's several questions around that.
Let me try to answer that as best I can. That is why we are utilizing the workbook that Forensic Analytic has developed, because that will help us not only address what's needed in that space, but also understand how many individuals can occupy that space so that we can achieve the proper air exchanges. So for example, there may be a science lab that's operating above standard, but there may be a classroom that may need a forensic analytic has also identified equipment that we can purchase to assist with the air exchanges and the filtering in each classroom. So that is, again, is part of step 2.
Okay. And then did I hear correctly that we'll be hiring OPD to come in and work on our campuses?
No, you did not hear that.
Okay.
Paul, did you say that?
I did not say that. I'm working on what's called an MOU. And what that is every community college is required to have MOUs with local law enforcement in the event of emergency response and to investigate crimes. Part of the Clery Act compliance is that they have an MOU with law enforcement in order for the college to receive federal funding.
Okay. And is that phone number answered 24/7?
Correct. 24/7. Someone is there every shift.
Okay. And does the language of the policies requiring staff, faculty, and contractors to be vaccinated also apply to our trustees, vice chancellors, and chancellor? In other words, are these entities also explicitly required to vaccinate or submit exemptions? And it looks like Vice Chancellor McKinley is responding to that one right now.
Yeah, I just did, yeah. All employees are required to be vaccinated or have an exemption.
Okay. Since the district is requiring vaccination, does that mean that the district is taking on the liability for any adverse effects from the vaccine?
I'm sorry, that I cannot answer. How about if we get back to you on that one?
Okay, I'll include that on the chancellor has indicated that will likely the questions that we are not able to answer or that may take some investigation to respond to will be included in an FAQ and published afterwards. So just so everyone knows, we will get to all of the questions, if not now, given our time and given like information right in front of us, we will respond to them. And I'll look for further ones. You guys can go forward and I'll look for other questions.
Great. Thank you. Thank you, Maisha. There's 2 parts of this HERF spending plan. The first part, I'm going to turn this over to IVC Adil Ahmed, if you would go ahead and speak.
Thank you so much, VC Brown. I'm gonna talk about HERF 2 student debt relief. I'm presenting to you today an overview of how our institutional care fund were used to reduce student debt. PCCD used HERF 2 funds, institutional portion, used to support outstanding debt relief caused by the pandemic. Many institutions choose to support students by addressing their qualified debt as an allowable use of HERF funds. As a district, we successfully cleared outstanding debt of $2.8 million for summer 2020, fall 2020, spring 2021, and summer 2021, broken down as follows. Berkeley City College, over $732,000 student debt wipeout. The College of Alameda, over $364,000. Laney College, over $736,000. Merritt College, over $939,000. So that was a great thing to reduce our student debt. And lastly, the campus president will be giving an overview of the respective spending of HERF funds and an approved plan for HERF 3 at the October 26th Board of Trustee meetings. And that's what I had to say about the student debt relief.
And thank you, VC Ahmed. I just want to talk a little bit about the type of spending for HERF 3. There are 3 different types of spending. We based one on the stipend FTEs, that's one cost. That was $1 million that was taken from the HERF 3. The second is cost proposals. When we go over the chart, we can look at HVAC costs from ACO. Those are proposals. Those are hard costs. Those are number of filters. All the filters were changed to provide clean air at this time. The third cost, which is a shared service cost based on square footage. There was a little discrepancy in some of the square footage. Some areas had to be added. The total square footage at this time was 1,147,633 that we've counted. Those costs you will see, excuse me, represented in the cost for HPLE, healthy building science, forensic analytics, signage, Ray and Associates, PPE, and additional security. They will be divided proportionally based on square footage. I'd like to also add that the HERF spending was only spent at the colleges. The district will be utilizing deferred maintenance funds to pay for its share of the return to campus. Next slide, please. Again, this is just the breakdown. This will be posted for all. You'll be able to review it. This is the allocations that we received by college. Berkeley City College, College of Alameda, Laney College, Merritt, and the total, $16,690,659. Next slide, please. From that, there's the percentage. 15% Berkeley City College, College of Alameda, 23%, so on, and the district office is 5%, totaling for the square footage that was serviced and cleaned. Next slide, please. Here is a breakdown of the phase one. Again, I just wanted to go the ACO costs. Those are hard costs. Those, we have the proposals, they've gone to board. It's not based on percentage. It's not based on square footage. It is based on the actual cost of the filters to change them. HPLE, their proposal, 65,000. And then again, it's broken up into percentages. I'd like to also bring to your attention that the cost only for the district office will be paid out of deferred maintenance funds. Next slide, please. This is a little bit more of a breakup, what we're anticipating for phase two. Again, it's going to be a more extensive cleaning. We are going to purchase filters, work with our engineers. We're going to look at the efficiency of the HVAC systems, and also we are going to have to replace some of the units. A timetable will be given. We will let you know what our next steps are. There's going to have to be a RFP put out for the PM services for that. Again, we will ask for Healthy Building Science to come back and do testing for us. We will ask Forensic Analytics to, again, continue its testing for HVAC, and also purchasing water filters for all drinking fountains or where water filters are needed. I'd like to go back for a second. Ray and Associates, who did the cleaning for us, that was an RFP. That RFP was extended to ensure that we got a proper response. Ray and Associates, who has worked in the district twice before, in March in 2019 and previously. And then they've been doing cleanup throughout for us. And so they were awarded the contract. They were the responsible lowest bidder. Again, we are looking at phase two, possible things that we will need, generators, PPE, and we're looking at our security. All of these things will be posted for you for review. And there will be, for phase two, there will be more discussion on that. Thank you. Next slide. This is just a summation of all the costs. you can see where the cost of phase 1, the cost of 2A, the things that we know we have to do, the cost of 2B, things that we're not sure how much it's, where maybe supplemental cost that's going to be needed, those totals, the HERF3 funds, there's a line item of how much is available, and then the total cost of which campus. You will see at the balance in the bottom, there are some negative costs. We will look to our scheduled maintenance, deferred maintenance funds to even off those balances and zero them out. Again, the district office will be paid out of deferred maintenance. Thank you. Next slide, please. Any questions?
Yes, there are several questions. Hussein asking about shared governance and what shared governance channels the HERF spending plans have gone through.
Again, I may defer this question to the chancellor, but there was a limited time. We had an RFP that went out for the cleaning. We had regular meetings with college leadership. So that is part of our shared governance. There was less than 30 days to get this going, and we were in summer at this time. So there were some urgent, HPLE was awarded an urgent agreement based on their specialty, their experience, and their experience with the district. So Chancellor, I will defer to you to add to that.
Okay, I will say a couple of things because I've been asked this question more than once. As we indicated at the beginning, this district, contrary to other districts that I've worked in during the COVID-19 crisis, had all of the funds that we received from CARES or HERF funds allocated to the campuses. That's the first thing. And that was not true for the district that I just recently worked with. There was earmarked funds that were put aside so that those funds would be used to address issues that were district-wide, not campus-specific. Because all of the funds were allocated to the colleges and put in the colleges' cost centers, I had several meetings with the senior leadership at the campuses regarding how we were going to pay for return to campus. And the district does not have that amount of money, as you've seen from the charts that IVC Smith provided, in a short period of time of less than 30 days, other than the HERF3 funds, which came late in the summer and that had not been relocated to discuss and to come up with a plan. So the agreement at the senior level was that those funds would be used to remediate those particular campuses based upon the square footage and a cost efficiency from doing it from a single source versus having every college go out and try to do it on their own. That's why we have a district. So it did not go through a traditional shared governance process. I would like to think that the presidents shared that not only with their administrative staff, but also in other forums, but I will let the president speak to that themselves. As IVC Adil Ahmed indicated, the presidents will be providing an update on their CARES funds to the Board of Trustees at the second meeting in October. So I'm sure prior to that time, those questions can be addressed, but that was what happened. They are not district funds. I take issue that they're district funds. We aren't using them at the district. We are using them to remediate the concerns that are present and that we presented to you at each of the campuses. So when you say district, it means that somehow the district is using them for its own purpose, and that is not true. We are administering the funds so that we can have a cost efficiency in addressing all of the myriad of things that you saw on those slides from forensic analytics, in addition to prepping the colleges with signage and all the other things that IVC Smith presented to you. So that is why we did what we did. And that was the agreement that was made before we went forward with this. There was no usurping authority from each of the college presidents. That was the agreement that was made across the board.
Thank you, Chancellor. It is 11:32 a.m. We're 2 minutes over. There is a myriad of questions. Thank you, everybody, for submitting your questions. Clearly, we didn't have enough time to get them all addressed in real time during this 90-minute webinar, but we will endeavor to get all of those questions answered. We'll continue to work on providing the answers. We'll post the Q&A, and we'll post the slides and a recording of this presentation shortly. And with that, Chancellor, is there any closing remarks that you would like to make?
No, Mark. Thank you, everybody. There are a lot of challenges before us. I don't even want to try to minimize that. We're going into, I feel like Star Trek. We're going into uncharted territory. We're going where no man has gone before, but we are doing it, and I think we're doing a pretty good job of it. We may not take care of everything, but I would hazard a guess that, and I would ask anyone to challenge me and show me a place that is safer than what we've done to guarantee that everybody that comes through the doors are tested, have already been vaccinated, or are getting weekly tests. And I mean, in any venue, if you can tell me, when you go to the store, when you go to the gas station, when you go wherever you go, are they taking those kinds of precautions? And I would hazard a guess to say no. So we are doing, I think, above and beyond to try to make sure that our place is safe, not just for us, but also for our students and our community. And if there's something that we can do better, please let us know. We are open to suggestions. It's real easy to stand on the side and point fingers and say how bad we are, but it would be better to give us a solution of how to get better. So I ask you, in the spirit of Ubuntu, please, let's continue in that vein versus pointing fingers and calling names. Thank you very much. We will get this up as soon as we can, given that we have a myriad of questions, and we want to make sure that we address those questions. Thank you very much. And thank all of the staff for being here. Appreciate it. And our partners.
Thank you. Bye-bye.
Bye-bye, everybody.